I am Nahed Kabbani, and this is the Lighthouse for today's viewers. Welcome to our show. Today, I will address a new issue. Even I always said that technology is my friendly enemy. Today, technology is my friendly friend, not enemy. As I always said too, reach out, go out, look around. You might find something you never know about it before. That's what happened with me and my daughter when we went to the convention center when they have the women business event. We went to look around and check out what there is in the market for women to know about it. We found a real good technology, advanced technology, and we stopped by at that point. And we did that business. We checked that. That's why I like it. I brought the subject to you today in the show, and I brought the whole business to you to know about it. You might benefit from that. And the doctor who is with us today is chiropractor for healthy family and family health, chiropractoring, and caring about the whole health for the family in general. I will let him introduce himself to you to let you know his background. Will you please?
Yes. Hello, I'm Dr. Stephen Barham. I'm a chiropractor. I've been a chiropractor for 23 years now. And I love doing what I do, and it's based off of some of the history that I had in the past. I was an athlete. Mm-hmm. I played football and baseball in high school and college. And unfortunately, I injured my lower back. Mm-hmm. I herniated 2 discs. And the orthopedic surgeons that I went to 2 different ones. And they told me that I would need surgery. And I was 20 years old, and I just didn't want to, go that route. And somebody happened to tell me about chiropractic, and so I didn't know a whole lot about it, and I took my chances at that time. I just didn't know, and it made significant, changes in my life, and it actually turned things around. I never needed to have surgery. And my life was changed because of it, and that's what drove me to be a chiropractor. And so I'm excited about it. We have a lot of new technology, and my office is family friendly. We treat a lot of families, and we've helped thousands of people over the 23 years.
That's good. So you get hurt, and that pain led you to be a chiropractor.
Yes.
That's why you take the pain from people now.
That's right.
That's
right.
really something.
Yes.
It caught my attention, and at that day, the machine, what you used in the show.
Yes.
At the convention center, and it was something unique, unusual. Mm-hmm. Either me or my daughter, we were impressed because we saw where is the pain and what it caused the pain on the screen in front of us after they took the X-ray for us. So that's why it is something I didn't see it before. And I believe it's something after I visit your place and I knew what you told me about, I understood that there is something new in the market. And there is something I would like to share with my viewers about how we can heal better and have better health through this technology. So it is your division, it's your talk.
Thank you. So what you experienced at the show, we had surface EMG. And surface EMG is like an EKG. It reads things at the millionth kilovolt. Actually, the heart EKG is read at the 1000th kilovolt, so it's very accurate. It shows how muscles contract. And muscles usually contract because they're guarding and they're protecting a particular area. So if you have a lot of contraction going on in an area where it's real hot, then that's usually an area where the muscles are having to work really hard to compensate for the actual joints that are there. So it's a great way to take a look at the spine along with x-rays and all the other types of technologies that we have today, so that we can place all of those things together in order to make a great evaluation or a more accurate diagnosis of specifically where the problem is, how it's angled, and those types of things. So that was like a first step to really identify that potentially there's a problem going on in the spine itself. And so that was the first thing that we did. And then when you came into the office, then we do very thorough evaluations as far as our history. Then we do an examination that consists of ranges of motion and orthopedic tests that rule out nerve interference. It rules out degenerative changes that are going on in the spine, osteoporosis, arthritis, all those types of things. Then we take x-rays, and that gives us even more information. And then we sit down with the surface EMG, the x-rays, all the tests that we do, and we combine all those together to then make a diagnosis to further help the patient if it's something that we can help, or if it's something that is a chiropractic patient. And that's one thing that separates us. Now, we also use a neuropathylator. And the neuropathylator is great because most people, if they have a mid-back problem, they might have acid reflux, or they might have some digestive problems. If it's up higher, it may be that they're having asthma, or they may have bronchitis every year, or weaknesses in those areas, or in the heart, they might have heart palpitations. So those are things that actually can be associated with nerve pressure in those areas of the spine. And that neuropathylator is nice because when I am going over that with the patient, they're able to see not only why they may be having mid-back problems, but also why they may be having acid reflux, or digestive problems, or headaches, or pain down the leg. So it's a nice technological component that we also have in the office.
And that's what I tape at the office?
Yes.
Okay, so I show it to my viewers, and
Yes.
it will explain it in details after this part.
Yes.
So I believe that's a good introduction.
Great.
And I think after the break, we will start another segment. So we'll be back soon.
You're watching The Lighthouse for today's viewers, brought to you by oneworldforyou.org.
So we all know that there is a chiropractor we can go to, but a doctor chiropractor, it is something I get confused, and I like to ask my guests also how to explain it to me. What does that mean? Doctor chiropractor. Will you please?
Sure. Chiropractic is where you have hands-on. It's hands-on treatment. We use advanced gentle techniques in our office, and that's probably what separates us from a lot of other chiropractors. We learn specific techniques in school, And those techniques vary from individual when you get out into practice. And what happens is that each chiropractor really develops that technique to fit themselves. So really it's unique for that person. That is why it's very difficult when you have had chiropractic care to go to another chiropractor, because the art of chiropractic might be a little different for each one. And the one thing that I believe separates us from a lot of other chiropractors is that we use some very gentle techniques that are very effective, so it's very comfortable for the patient. However, the patient gets phenomenal results with it. And there's a few techniques that, obviously that we're going to be using that many others don't, because we have, advanced those skills over those 23 years. And we are dealing with usually a condition that is the most common condition that comes into our office, and it's called subluxation. So it's a tricky word, it's a tough word, but it means less than a dislocation. It's where, if you look at the model that I have over there, you can see that a subluxation, thank you, this is what the normal spine should look like, and this is a cutout version of what the spine looks like. And what happens is that you have a real thick, healthy disc that's in between the bones. And then what you have is you have bones that are in alignment, and the nerve itself is very healthy because there's no pressure on it. What happens in the course of life is that even from age 0 to 10, most people experience trauma. I have 4 kids, and it's amazing that they make it through, because they'll jump over coffee tables, they'll jump on their bed, they'll roll off, fall on the floor. There might be an auto accident, there might be a sports injury that takes place in your life. And all those types of things add up. And if the force is strong enough, it can cause a shift in the actual bone structure itself. So the bone can actually shift, and that can start the process of what we call subluxation. Subluxation causes some nerve irritation over time. It may not happen right when the shift occurs, but as time goes on in life, it weakens that area because you have muscles that are working real hard. And what happens is that causes interference in the nervous system itself. Then there are these messages that come from the brain. And those messages are interfered with of reaching whatever body part, whatever organ, whatever muscle, whatever tissue that's going to, that's going to cause that function not to work at its optimum level. So all of a sudden, the patient may experience pain. They may experience the strength is not quite there. They notice
numbness.
Exactly, numbness.
I guess this is what I had.
Exactly. Numbness or tingling. Then it can develop as time goes on into other things organically in the body, where they start having digestive problems, or vision gets affected, or different things. And we don't cure anything as a chiropractor. The body does. All we do is facilitate the body to work at a better level. That's what allows the body then to optimize and heal itself. The body is a very powerful organism. And the brain and spinal cord. It functions very well when it's working at an optimum level. And that's why if you put 10 people in a room and there's a virus, not all 10 people are going to get the virus. You might have 6 that get the virus, but 4 don't. It's because their immune system's working at a higher level. They can fight off the exposure to the virus. And so our job is to optimize the body by getting the nervous system working at a great level, and then that's what allows the body then to heal itself very efficiently. So really that's the power behind chiropractic, is finding the subluxations correcting those, and then the body does the rest.
Is this what you got from the questionnaire at the beginning? Because those questions were touchy to the second, maybe. I was surprised from the question because she described everything I feel through her question. Do you feel this? Do you feel that? Details I never heard from any doctor about to describe what you are trying to make a case from the answers.
Interesting.
It was really interesting for me too.
Great, that's awesome.
So we learn.
Yeah.
So that is something advanced for sure. That's what I felt also.
Great.
And as a family chiropractor, healthcare, you take care of the whole family, or you deal with the kids and adult and elderly people and everybody?
That's a great question. I have newborn babies all the way up to centurions that are 100 years old that we treat, because we have techniques that are really gentle that we can treat. And I'll talk about babies a little bit, because a lot of people are like, well, why would you treat a baby, right? And there's reasons for that because of the trauma that they go through the birth process. They're usually ignored, but I mean, I can't tell you the number of times where a baby comes out and they got a fractured clavicle because of the trauma that they go through. There's many things at a much more subtle level, like a baby might be colicky, or the baby might have sniffles all the time.
And we don't know why.
Right.
He born this way.
Exactly. And what's amazing is a lot of the babies that I treat, I'll treat them once or twice, and the colic, the mom's like, thank you, I can actually sleep through the night. My baby is actually sleeping through the night now, and it was just one treatment. Babies respond really quickly like that because, it may be that there's just a little interference going on at certain levels. You get that interference corrected, and the baby, it's not traumatic to the baby, and the mom is a lot happier when the baby's
and I believe you
sleeping
like to
through
make
the night.
moms happy.
Yes, and then on the other hand, when we're treating the elderly, when we're treating 90-year-olds and seniors, they their bones are a little more brittle and they might be osteoporotic. So we have techniques that we can use that makes it very gentle, to where it's very safe to treat those types of conditions, and they can get great results to where it can increase their range of motion, and it can increase blood supply to the areas, so it allows those areas to function better with treatment.
Actually, nobody planned to get hurt, but easy to get hurt. Even if you move your body different or wrong way, you get hurt immediately. But the pain to carry, it's really a killing pain, and you cannot function if you have pain.
That's right.
And sometimes we carry that pain because of certain things. But really, anything in life can make us get hurt through that, or just slip your foot, have something. If we didn't find the way to heal it as soon as possible by ourselves, we have to ask some professional to do. Otherwise, we will be having trauma after trauma without notice.
That's right. That's right, and they could accumulate. Usually when there's something like that actually creates some pain or a problem, if it's not really addressed, it can come back and actually become worse, or it can become chronic and really harder to correct too.
Everything at the beginning easy to heal, but every time you add time, it will be tough more, and we're getting older a little bit more.
That's right.
So this is a good point, actually, and we'll talk about more details after the break.
Great.
So we'll have a break, and we'll be back soon.
OneWorldForYou.org, promoting cultural understanding through the media.
Okay, let's talk about other things our doctor have at his clinic to help us through his kind of specialist. What do you have? I guess I saw so many things in your office. Can you
Yes.
explain to us?
Yeah, well, there's one thing that we look at. There's 5 factors of health. And those 5 factors are really important. And so we want our patients to engage on all 5 of those factors. And one of them is diet. And one of them is exercise. One of them is positive mental attitude. One of those 5 phases is sleep wellness. And the other one is a sound nervous system. So those are the 5 health factors that we really emphasize to our patients. And we've discussed a lot about having a sound nervous system because those are the components that we actually treat patients and help them with. However, the other 4 are very important, and usually when one's nervous system is starting to work at a better level, that motivates them. Now they feel better, so they'll feel more like exercising. They'll feel more like doing all those other 4 components because their body is telling them that's what's good and they can do it now. They're more enthusiastic and more motivated because they're starting to feel better. So we talk about diet and exercise. First in the diet, we teach people how to have more of an alkaline diet as opposed to an acidic diet. Acidic diets are the things that lead to cancer. They lead to free radicals in the body. When your body's more acidic, your bones and your joints hurt more because that acid builds up. Your body breaks it down, but as you get older, your body doesn't break down the acids as well. So it just causes a lot more toxins and problems in the body. So we teach people to eat more alkaline as opposed to acidic, where they're eating more organic foods, more lean meats and vegetables, and good organic vegetables and fruits, legumes, and whole grains. Those are the things that we really work with them. And then the other components, like your processed foods, your cookies, cakes, all those things that we all like, and every once in a while we can treat ourselves to it, but it's something that really is not healthy for the body. And one of the things that we emphasize also is that stress is a big factor in people's lives nowadays because of the technology that we have. It's like, it's hard for people to put their phones down even.
Yeah.
And just to take the time that they need to relax, take deep breaths, meditate, and just, find that inner person in them. I mean, they're spending so much time, doing this or interacting with something. And so that's something that we really emphasize is the importance of getting rid of that stress in the body. Because what that does is that causes toxins in the body where your muscles are the holding tanks to those toxins. Your liver detoxifies it, but your muscles are holding all those toxins. So what do you think those muscles are doing? They're just, they're tightening up. And then that can pull on and shift things and cause nerve interference. And then we have pain and discomfort, and our bodies then are not optimized and working at the levels that they should. So those are techniques that we work with people on. We work with people on exercise. And I teach people that 30 minutes a day is great if you're going to take a walk for 30 minutes, or if you're going to ride a bike or swim or do some cardiovascular or those types of exercises. We encourage them to try to get 30 minutes in a day. Now, sometimes that sounds easy, but it's really not because of our busy schedule. Yeah. So I teach people maybe it's 10 minutes that you just take a power walk for a break, get out of the office, take that 10 minutes, come back. Now your body's more refreshed, you've counteracted. And then there's another time where you take another 10 minutes where maybe you climb up the stairs and go down the stairs. Those are things that are important, and it'll help your body actually burn some calories off. It'll help your body just reduce the stress. And you're getting endorphins that are released in your body, so those are good things. Then we talk about the positive mental attitude.
Yes.
That is so important, and it's one of the 5 factors of health that we often forget about. It's not discussed as much as like diet and exercise, but having a positive mental attitude is a real key. In 23 years of practice, the patients that I see that do really well in their lives and stay healthy, their attitudes are always positive. They're optimistic.
Yeah.
When it sure does, yeah. And I mean, when they're negative, they turn that into a positive, you know. And so those are things that aren't as easy to help somebody with, but we can encourage them. I always tell people when they wake up in the morning, they might have 5 negative thoughts, and you turn those into positive. Like instead of, oh man, I have to go to work today, or I have to get up, you know, we encourage them to say, how many people can we affect at work? How many lives can we encourage, or just, you know, how many people can we really help by loving on them, or changing their lives in that way? So that's an important part, I think, of human nature. Yes. is to make, you know, those impacts on people's lives. And I think once you have a purpose in your life like that, it makes life and the stress levels go down substantially.
As you mentioned, if we take some time for ourselves to find what is in it, in ourselves,
yes,
it will help.
Oh,
because everybody is born to this world, came to this world with purpose.
That's right.
Nobody came just to live. God gave us purpose, but let us find what is the purpose to be able to follow.
Yes.
And do.
Yes, I really believe that.
Yeah. Without thinking this way, I couldn't function. I was sick. I was out of order. Like
right.
You don't live like shadow. Or
that's right.
You are right.
That's great.
So better attitude, good attitude will help to solve a lot of problems and give a chance for other people around you to adopt it, learn from your attitude.
Yes. Yeah, and then one of the components is the sleep wellness. Most of us don't sleep very well. You know, we're, you know, maybe watching TV till late. You know, it's common. Nowadays, it's common to have TVs in every room.
Yeah,
So you lay down in bed and you're watching TV.
Become spoiled and lazy.
Yes, and you know that there's real important chemicals that are released in your body. One of them being serotonin, which is a key chemical that really blocks pain in your body. It helps your body just function so much better. So it's important to produce serotonin, which is a key chemical, and to get that proper sleep, and to start learning about ergonomics of the right kind of mattresses, the right kind of pillows that will help your body rest better. And then obviously the final one is the sound nervous system of the body. None of those will work to their optimum if your nervous system is not working at an optimum level. So that's why it's important to get checked up, to get tested, to see where your nervous system is at in your body.
That would be good advice, really.
Thank
you. It caught my attention today on your screen. It says when you sleep on your stomach. That's a sign for what?
When you're sleeping on your stomach, it's it's not an ergonomically correct way. And a lot of us, that came from our childhood of being put on our stomach, and usually we hike a leg up on one side or the other because that takes some pressure off the lower back. But the problem is gravity is pulling your spine down in your lower back, so it's very uncomfortable and not good for your lower back. It's also not good for your neck, because you have to turn one way or the other. Most people, if they're sleeping on their stomach, they have a good way. They have one way that it's comfortable for them, and one way when they turn, it's not comfortable. And that's because ligaments are contracting on one side and they're causing ligament laxity on the other. So it definitely causes problems in your neck and lower back lying on your stomach.
Mm-hmm. What else I saw? The nerves system.
Mm-hmm.
Is there any special thing we would like to talk about the nerve system?
With the nervous system. Well, the biggest thing I'd like to say is that the central nervous system, your brain and spinal cord, is the first thing that develops in utero. Mm-hmm. And there's a reason for that, because it controls and it directs everything in the body, even your hormones, your vasculature, your blood supply. Every cell, every tissue, and every organ is directed by that central nervous system. So it's very important to understand. It's like if your computer has a virus in it, it's slow, it doesn't work as well, and it's frustrating. Well, the same thing in your body. When your body is not working at an optimum level, and it's not firing, and those messages are not being received to the fullest to maybe your heart, your blood pressure is going to go up. If it's not firing correctly to the arm, you're going to have pain, you're going to have dysfunction. So that's why it's important to get your nervous system working at an optimum level. And even taking the right supplementation and diet and exercise, that also helps optimize the nervous system too. And so that's the key behind the nervous system, is getting it to work at a high level. And then that's what will allow the body then to heal itself very efficiently, and to accept all those other good things that you're putting into it, like good diet, good exercise, positive mental attitude, and having sleep, good sleep. Those will all work well for the body then too.
That's something we should pay attention to. And the arthritis and old age.
Yes.
Is this something you can help with or no?
It's
like rheumatism and bone things.
Yeah, we can really help manage and stop, slow down that arthritic process. Arthritis, if it's related to subluxation, which we talked about before, where there's a bone out of place causing pressure on the nerve, that's just like if the car's out of alignment. What will happen to the tires and the shocks because of that extreme pressure on them is they'll start to wear down. The same thing happens in the spine. When you have bones that have shifted out of place, it will cause an abnormal wearing and grinding on those bone surfaces and discs. And so that will cause arthritis, which is inflammation of the joint. That's what that means. And so we have a lot of elderly patients that come in and their hands are arthritic, and we can actually treat that, and it gives them better range of motion, it reduces the inflammation, and it slows down the arthritic process so it doesn't keep progressing at a fast level.
That's really something helpful, because the length of life now cause living with so many unpleasant things. Yes, we are healthy to live to the 100 years, but not with no pain, with no nothing. So this kind of service or treatment will help adult elderly people to ease the pain.
Yes. I mean, one of the things that I really focus on is not even so much the pain, but the patient's activity of daily living. Like, I'll have patients that come in that like to play tennis, or they like to play golf, or they like to work out. And they can't do those things because of the pain they're in, so they have to change those things in their lives. And it could be a simple thing like tying your shoes, All of a sudden they start buying shoes that they could just slip on because they can't do that anymore. Those are the types of things that we like to see change. We like to change that in their life. And those are the goals that I set for people, is how can we do that? And are you a candidate for care? And can we change that for you?
Well, this is the advance what you have, because usually they are old enough to not be able to do it.
Right.
It's normal, and
Right.
we keep it quiet.
That's right.
So that's something we will come back to after the break.
Great.
So we'll have a break and we'll be back soon. So this is the best part for you, my viewers. We'll talk about details, how we can help you through our guest service when you visit his place. First, I will take our guests for a short tour to your place and show them what do you have at the office. So let's watch it together.
Okay.
Okay.
Our reception room area, and this is our education area here where many of our patients come over here, and we have lots of educational pieces where patients can actually get information according to their different problems or what they have questions about. So this is available for all of our patients to take as they want. They can take any of these. There's no charge for any of these types of things. We also have other supplements, and we have pillows, orthopedic types of pillows. We have orthotics that help support the feet, and we have different shoes actually too that are available. And we have as you can see, a beautiful reception room here. And so you can come right this way. These are our treatment rooms, and this is where we actually perform specific gentle adjustments for the patients. And as you go in here, one thing that separates us from a lot of other chiropractors is we have state-of-the-art electronic information for our patients that actually have their x-rays put up for them. I can give an example of that. To where they have specific notes and things like that that we can do that really separates us from a lot of other chiropractors. We also have information here on nutrition, on chiropractic, on exercise, and this is very informative to give patients, so that helps them to understand how to take care of their condition outside of the office also. We'll proceed this way. This happens to be our hydro massage room, and patients can come in, they can have hydro massage. It's very relaxing on the muscles and the soft tissues of the body, and it's very effective for like muscle spasms and types of conditions such as those. And this is a therapy suite here. This is designed also to treat patients that if they have inflammation or they have muscle spasms, it helps us to get those taken care of before we actually adjust them and treat them.
X-ray?
Yes, this is our x-ray facility, and this is where we actually can take x-rays here, so the patient does not have to go to another facility for x-rays, and we have all rarer screens so that we don't have to worry about really low radiation also. This is my office here, and this is where we do a lot of our histories, our report of findings. We go over x-rays with the patient here. We also have state-of-the-art, we have a neuropathylator, which is really great because it actually shows the patient where the problems are in the body. So if we look at the x-ray and we see something that's out of place, we'll say that L5 is out of place. We can see that it may be affecting the leg, that may be affecting also some of the organs of the body, because those are the nerves that control that area. If we go to another area of the body at L1, it shows us that the large intestine can be affected, but it also shows us that mechanically that can cause other types of problems in the hip. And then as we move up through the spine, we can look at the mid-back, and we can see different areas that are affected there and what organs are also associated with that. For instance, at T8, the spleen is affected by those nerves. So if you have a nerve that's being interfered with at that level, that can affect the spleen also. So that patient may have some problems with the spleen also, in addition to having back pain. And this also relates to the neck area also, and we can see how that can affect the arm. It can affect the head, where you can get headaches. It can also affect different organs of the body also at that level. At that C2 level, it's affecting the eye, the lacrimal gland. Below that, where it's affecting the sinuses. So if a patient has sinus problems and headaches along with neck pain, there's a good chance that that's associated with that particular area of the spine. So this is some of the latest technology that really helps us, and I really believe that it separates us from a lot of other chiropractors too. And so
that's what it caught my attention.
Yeah.
At,
Yeah.
Convention Center.
Yeah. This also is our charts of degeneration, and the degeneration charts help a patient to see where they're at. And if say a patient is 50 years old, if a patient has a normal, healthy spine at 50 years old, it should look like this. As they go through degenerative changes, and if they have something that's been out of place or has shifted, if there's a bone that's been shifted out of alignment, it can cause more wearing and grinding, to where it can cause some other different problems in the spine. So when we look at their x-rays, it helps us to correlate their x-rays with these different types of conditions that are present. Okay. Full massage. This allows the patient to work on their muscles, and we have hour massages, we have half-hour massages depending on the needs of the patient.
So now we saw what you have. If I will ask my guest, you can invite my guest to your place. What you offer the viewers?
What I would like to offer them as a gift is we provide the services that we provide normally through the consultation history, examination, the surface EMG, the x-rays, and myself or my staff going through the x-rays bone by bone with them, giving them recommendations. That whole process is okay.
Special price or reasonable price.
Yeah.
But it is a gift from you to our viewers.
Yes, it is.
To have the checkup.
Yes.
To know what they have, then they go and decide what they like to do.
Right, right. So I would be happy to do a checkup for them. We could review all that, and we would be happy to
to feel what is the technology means to them and
Right.
what they have to fix up in case they want to.
Yes.
That will be fair enough because I like them to see what I have seen and to find out if they can benefit from that, like me as benefit.
Right.
For elderly people, what you can offer them
Well,
as a
for
special treatment from your office.
yes, so for senior citizens, we provide a senior citizen discount, and we're one of the few offices that do that, and that allows them to get care at a reduced rate that makes it very affordable for them. And we have been doing that for many years now. And it makes it very easy for senior citizens to actually get the treatment that they need, and it makes it very affordable for them.
They have Medicare.
Yes.
Senior citizens, they have Medicare. Is
Yes.
it acceptable, or what is it for?
Medicare is nowadays it's a benefit more than insurance, and what that means is that if, for instance, a patient has a fall or they have some kind of trauma that happens, then Medicare will pick up a certain amount of that. It's very limited though. And normally they don't get the care that they need through Medicare, but it might cover a little bit of coverage. What we do is we match what Medicare does so that we give them an amount that is very, very reasonable.
It's like the chiropractor is not in the medical field to be covered, or no need. It's separate by itself, not covered with the insurance, which make it hard.
Yes.
Either you have car accident to go to the chiropractor, or no chiropractor in your budget,
Right.
as
Yeah.
daily basic.
Yeah, really the difference is that in medical, usually you go in and there's one visit, and they do a bunch of things. I mean, that visit sometimes could be $400 or $500 or $600. Whereas in chiropractic, you're actually treating hands-on a condition for a period of time to correct it. And so the insurance companies, again, in my perspective, they look at symptoms and as far as symptomatic relief as opposed to correction. Big difference. And so they really don't cover that preventative care. And that's almost in every realm. I mean, medicine has to actually separate or segregate what's covered by the insurance companies and what aren't too. Sometimes the public is not getting exactly what they want from the medical doctor. He may determine what you get based on what the insurance covers. So it really can cause, if a person is looking at insurance as being for the correction of the body and covering that, usually that doesn't happen. Usually, again, they'll cover some portions of it, but not the entire portion of it.
That's why you see so many people live in pain, just because they cannot afford to
Yes.
go to the chiropractor.
That's right.
It is unfair.
Yes.
It's the same body.
Yes.
If he gets sick or get hurt, why we don't care about the hurt or
Right.
the pain,
Yeah.
but we care about certain things. I see it's not fair because it's a package. The human being as a body, it's all together.
Yes.
So, and it's hard for people with fixed income, or for most of the people, the majority have middle income. It's
Right.
hard to add to the budget the
Yes.
cost of going to the chiropractor, even they need it,
Yes.
which is
Yeah.
hard.
Which one thing I would like to say, because this is something that I believe makes a difference with people, is that if a person places enough value on their health, usually we can make it affordable for them to get the care that they need.
Mm-hmm.
And the biggest key is placing that value high. And some of the examples I use for my patients is that if the new Apple iPhone came out, and when the 6S comes out, I mean, you have lines of people waiting to get that new technology, right? But yet, if you looked in that line and you saw how many people could really afford to buy that, it would be probably not a high percentage of people, but their value is high in getting that because they want that technology.
Oh, yeah.
The same thing goes in healthcare. If somebody really values their health and their future, and they really want to have longevity in their health and do well and make that a priority in their life, it's really not that expensive to have care.
I was trying to say, even that line what you talk about, some of them have pain.
Yes.
They don't think about it, but they think about getting the new version of what they are buying.
Yes, that's right.
It's the value.
That's right.
But now we can tell our guests or viewers where's your location?
Our location, we're on Arden Way. We're at 3441 Arden Way. And we're close to Watt Avenue, and Arden, we're almost on the corner there. And we've been there for many years. And it's a very centrally located place in Sacramento. We get people all the way from Roseville and Elk Grove and Rancho Cordova and Davis.
I believe you have a lot of information on your website and
Yes.
testimonial and things. What is your website?
So my website is www.barhamchiropractic.com. And you will get a lot of information from that website.
And if my viewers come to you, they will mention that they saw you at Access Sacramento at the Lighthouse for today's viewers program.
Yes.
And you will take care of them.
I will. I'll take extra good care of them.
I know that because you took care of me and I had pain, and everybody around me knows that I got hurt through a car accident 3 years ago and still struggle with. And you broke my neck, but you fixed up.
That's awesome. That's awesome.
You fix it up as old time.
Thank you.
And I appreciate your help. At least I walk better.
Yes.
And I'm smiling now.
That's great.
At the end of the show, on behalf of my viewers, I would like to thank you for coming to our show. And really, really, I appreciate the information and the help what you gave us.
Thank
and
you.
the time what you gave us.
Thank you. It was a privilege. Thank you.
You're welcome. And for you, my viewers, on behalf of my guests, I thank you for watching. Hopefully, you will benefit from what I brought for you today. And hopefully you will stop by and check in. It is free. It is a compliment, not free, almost free. It's a complimentary visit, at least to check that technology, advanced technology at his office for your health, a friendly technology. And from that time, I would love to hear from you if you went there and what you find, if you like it or not, if you like the information what we gave you. I'd like to see you sometime again. Thank you for watching. We'll see you next time.